It's time to put your health in your own hands. Get ready to learn from today's top health and wellness innovators and thought leaders on Optimal Health Radio. Now, here's your host.
Hi, everyone. This is Dr. Tammy Patzer, and I'm really excited to introduce today's guest, Dr. Anthony LeRoy. And he is the founder of Rockland Laser Pain Office in Pomona, New York. Dr. LeRoy has been changing lives since 1996, integrating chiropractic care, nutrition, and innovative therapies to treat the root causes of pain and dysfunction. He specializes in regenerative class 4 laser therapy, offering a proprietary, gentle, and painless approach to healing. At Rockland Laser Pain Office, Dr. LeRoy and his team are on a mission to help patients ditch the drugs and skip the scalpel by reducing inflammation, swelling, and pain while accelerating the body's natural healing process. They provide a comprehensive solution to even the most debilitating conditions. Dr. LeRoy, I am so happy to have you as a guest today. Welcome.
Thank you. Glad to be here.
So let's just get started. Can you give me a little more background? I understand that you actually started out as an electrical engineer, and then, of course, you went on a journey, and then now today you've added the laser pain office to your practice. Can you just tell me more about your background?
Yes, I started out, like I said, I started out as an electrical engineer, worked for about 5 years in the industry. I was doing a lot of sports at the time and injured myself, got involved with chiropractic, and I said, this is what I want to do. I want to help people, and I think a natural means is a good way to go as opposed to drugs and surgery. And I started out with an engineer and having an interest in technology. So I started using a lot of technology. In 2002, I was actually on Channel 2 News with the photon stim, which is a low level, I wouldn't say laser therapy, but a photon stimulator, similar premise to laser. And we were getting, from Channel 2 News, we were getting a lot of people with all sorts of pain conditions coming in which I was able to help them with like neuropathy, pain, chemo, the symptoms of neuropathy, all sorts of different musculoskeletal pain conditions. It was quite rewarding. And, I moved on. And then now with this new exciting technology, I just couldn't pass on the class 4. The technology has evolved so much stuff, just like engineering, constantly evolving. And I'm excited to be able to offer that to Rockland and residents and help people with a lot of conditions now that, people are just dealing with drugs and surgery as a last resort. And a lot of times it's not helping. Sometimes it does. But we're offering something that's, pain-free, drug-free, and hopefully make people more functional to carry on their daily activities of living or sports or whatever they want to do that they couldn't do before, be hampered by pain. So that's why I'm very excited about doing this type of work.
Well, you said it, laser technology, even like you said, you started out about 2002, proton therapy, and it has really expanded beyond that. I wanted to ask you a little bit more about that. How does class 4 laser therapy work exactly?
Well, it's basically based on photon biomodulation is what it's called. And it uses light in certain frequencies and wavelengths to penetrate the damaged tissue, increase circulation, increase ATP, which is adenosine triphosphate, which is an energy component that we all have in all our cells. And without that, we can't heal. So the more energy and the more light energy you get, the faster you'll heal. I mean, you can see now red light therapy is coming into vogue, but that's not as powerful as class 4. It doesn't have all the wavelengths, and it's not really laser, it's LED type technology. So, which is not a coherent light like the laser. But photon biostimulation is in vogue now. I mean, I had a certain condition, medical condition, and they recommended that I get light therapy, photo biomodulation stim. I said, I know all about that. I've been doing that for a long time. So they're catching on. It's slow, but they're catching on. It's a good therapy that doesn't involve any. It's safe, painless. What more can you ask for?
Well, you said it. I was just going to ask you about the safety of this regenerative laser. Is there a lot of practical studies or clinical trials behind laser therapy?
Yes, we have a whole stack of research papers. There's a lot. If you do PubMed search, you're going to find a lot of information on that. But there's a ton of studies on that.
Well, I think that's important for people to know because a lot of times they think it's like just the latest thing to come, but regenerative laser therapy is actually, it's been around and it's been more and more. And now, here it is. Like you've been in practice since the late 90s. So we're talking about 25, 30 years of advancement
Well, I've been practicing since 88.
Oh, 88. Okay.
Yes.
So I think it was that
That's okay.
One
But
of your
like
offices.
like I said about it's the evolution of it. It's funny because I actually had someone, medical doctor, oncologist, call me up, wanted to know how I was treating the neuropathy for the chemo, and I explained to him, and he wanted to know the research. And I had 4 or 5 papers handy, to show him and tell him. And he said, "How come he hadn't heard of that?" And I said, "I don't know, because it's in your university that these papers were done. So it's been around a while."
It is always interesting. I think about how so many times medical doctors, they're so focused on that specialty that maybe they're not paying attention to some of the other things. So
yeah, no one can know everything. They're using drugs. That's what they're trained in. Alternative things like light therapy and photon therapy, they're catching on. Like I said, I had to get some medical procedure, and they recommended that, but it wasn't class 4. It wasn't powerful enough. And I told them, but they're catching on. I mean,
that's good. That's good to know. So your office is all about a personalized approach to healing. So if somebody comes to see you, can you kind of walk us through what that first encounter might be like?
Well, first encounter is to welcome them, make them feel at ease, because they don't know, they don't even know what a laser is. Their probably perception of that is, laser surgery where they burn through tissue, which we don't do, obviously. And then I explain to them what it is, best I can, using graphic information so they can get a picture. Most people are visual; they want to see what it does, so I can show them. We do an exam, we do a very detailed history, and we see if we can help them. If we feel we can help them, give them a trial. Let them know it's painless. It's not anything that's going to hurt them. Let them feel safe, and then proceed with a program based on what their condition, how long they've had it, acute versus chronic, and other metabolic conditions they might be involved with at the time that might hinder some healing. But we go through all that, and then we proceed to treat them and monitor them.
So how long does it typically take for the patient to notice a change after?
Well, I'm using very high-powered laser. When I was using the low photon stim, I noticed that a lot of people were the next day, all of a sudden the next day they were getting it. So the laser treatment can continue for 24 to 48 hours after the treatment. And sometimes I go by palpation. I say, if it's tender here, treat them and see if it's still tender or reduce. That's my mode of assessment. Yeah, I mean, you can get a change immediately. I'm looking for that, but sometimes it's like I said, 24 to 48 hours. It's still working, and the body's healing.
So what types of injuries would you say would benefit the most from regenerative laser therapy?
Well, I mean, they're using laser now for wound healing, for toe fungus and things of that nature. That's not what I'm doing. My purview is more musculoskeletal, arthritis, shoulder, rotator cuff, carpal tunnel, golfer's elbow, tennis elbow, plantar fasciitis, knee pain, shoulder pain, neck pain, back pain, sciatica, and the symptoms of neuropathy. Those are the main things that I'm using the laser for right now.
So your office, obviously, you're a chiropractor, and you also provide nutritional guidance. So how does that complement the regenerative laser?
In a couple of ways, with certain conditions, most commonly, like you'll see diabetic neuropathy, the circulation's affected. So we might give some nutrition to increase nitric oxide, which is also increased with the laser, which is a vasodilator, so let the blood come in to heal. Sometimes we use some B vitamins and some other nutrition that help with nerve uh, healing. So we'll supply that depending on what type of condition they have.
So it sounds like whatever you are doing with your patients, it is a very complete holistic type experience, because you're not only dealing with just that, like my shoulder hurts, but it's
Right.
about the whole body.
Yeah, I try and it's a tough concept because a lot of people, it hurt. It's my shoulder hurts. It hurts here, but there's a lot of inflammatory conditions going on in the body that we do some functional tests and to evaluate that will help heal the process. Because most of these people, it's not an isolated thing. They're inflamed. Inflammation is one of the root causes of most diseases, including musculoskeletal conditions.
So let's dive a little deeper on inflammation and the laser therapy. So let's say your shoulder hurts, or your knee hurts, or your elbow
Mhm.
hurts. So how does the inflammation get affected? That, let's say your body is inflamed, but you're treating the knee or
Yes.
the elbow. How does that actually end up working?
It works synergistically with the nutrition because the concept again that's coming to the forefront is mitochondrial health. Those are the little organelles in your cells that make energy, and energy is what heals the body. The more inflammation, the low energy you have, the longer, more chronic conditions you're going to have, and more degeneration. So it increases the energy, the ATP, which is the energy currency of the body.
Oh, that's interesting. So you, it just clicked in my head that you know a lot about energy and our electrical components
Right, exactly.
because of your background, more so than the average uh, doctor. So it kind of just clicked in my head about.
Yeah, if I can comment on that, it's like a lot of people when they know I'm an engineer, they think in terms of mechanical. I say I'm an electrical engineer. I look for the electrical circuits in the body. That's more my approach than like a mechanical. This is out of alignment. This is structurally. We do combine that, but I do look for the electrical, the energy system. Being an engineer, electrical engineer.
Oh, that does make you really, really unique, because most, again, I don't think that most people really get how electrical we really are. I mean, it is fascinating.
Exactly. They don't realize they're an electrical being. I think they're
Yeah.
99 cents worth of boiled down chemicals.
Oh, that is interesting. So you, how long have you had been offering the regenerative laser therapies? Is it a new service or is
Yeah,
it?
this is like I said, I've done lower end. A lot of people doing what they call low level lasers. I've now graduated up to the class 4 high powered lasers for more penetration, quicker healing, and more energy delivered to the system, which they call joules. Those are units of energy. The more joules you can get, the more energy into the body, better you're going to heal.
So over the long term, so somebody, they come in, they get their evaluation, they start their treatment. How long, again, I know that you can't answer this question
Yeah,
specifically,
you're right.
but how long can someone expect? Again, we know that they're probably going to see improvement fairly quickly, but how long does it take your body to actually heal generally from
Well,
some
that's a
traumatic?
good question. I mean, initially, people have to understand it's kind of like taking antibiotics. At first, you get reduced pain, and then you have to continue to let the tissue heal. It's like an antibiotic. Once you get over, you take it for a day or two, you feel good, but you have to continue the course so the body can heal and you get rid of all the bad guys. So it's a similar concept. Um, for most, depending on how long you've had it, what metabolic conditions you have, how your energy state, they all factor into individuality. Um, but on average, we're looking for depending on what type of condition, 6 to 12 visits. If it's more of a spinal condition or a longer term neuropathy symptoms, it's going to take longer. But you should see results along the way. I mean, some people are so bad. I mean, even getting 50% reduction in pain, they're happy. So it's not like you know, you drop your car off to get fixed, and at the end of the day, you pick it up and it's better. you know, you have to work with it, and you have to do your part, and then we'll do everything to make sure that we don't fail. We get you better, so you can do the things that you couldn't do because of the hindrance of the condition, the pain condition. Well, I think we lost audio.
I'm fine. I just forgot to unmute myself. So if a patient wants to come in, what is the best way to reach out to you and make an appointment?
Well, I have a website and I have a phone number, and the best way is to either register on the website or call me directly. If I'm treating patients, I'll get back to you as soon as I can. Make it a
Okay.
priority. You want my phone number?
Yeah, go ahead and give us the phone.
Okay, 845-624-1634.
Okay. And of course, I'll make sure that the website links and all of your social media and telephone numbers and contacts are in our show notes. So before I let you go, is there anything you'd like to add, Dr. LeRoy?
No, like I said, this technology is regenerative and it's very result-oriented, high-powered type of treatment, and I'm very excited to offer it to the people and to make sure they can hopefully not rely on medication and not have to get surgery, and they can do the things that they were doing before they developed these conditions.
Well, thank you so much. So, everyone, we've been speaking with Dr. LeRoy, and he is with Rockland Laser Pain Office. And remember, you can ditch the drugs and skip the scalpel and reach out to him, make an appointment, check out his website, learn more. Thank you so much, Dr. LeRoy.
Oh, thank you for having me.
You've been listening to today's top health and wellness innovators and thought leaders on Optimal Health Radio. To get more solid health and wellness information, visit optimalhealthradio.com.